This is Sierra Namude, who you hear speaking. I am one of Umoja's steering committee co-chairs, and I want to open and say a sincere welcome to everyone who's able to attend today's session. It really is a special session. We will be talking about honoring the life and legacy of Dr. Charles Drew. With many of you as being associated with the Red Cross, know he's such a predominant figure, not only in the African American community, but also the medical community, but also the Red Cross community as well. And we are extremely honored to have two of his daughters as guest speakers with us today. And so, again, extremely excited that you all are taking the time to be able to join us today and learn more about Dr. Drew and all that he's done, and also learn some more information about a topic that directly affects African American community and some other minority communities, and one where the Red Cross definitely has a stake in trying to diversify the blood pool, which is around the topic of sickle cell disease. And so, without further ado, we will begin today's session. Just a couple of last minute housekeeping tips before we begin. For anyone that has joined this event via a phone, please mute your phone immediately. So that way all the guest speakers and all of the presenters can be heard, and that way you all can also hear all of the content that is going to be shared. If you have a question that you would like to submit for one of our guest speakers or a member of Umoja, you can utilize the Q&A function on today's event where you can submit your question. And if we are able to address it today directly with the guest speakers, then we will do so. If not, rest assured that we have captured them and we are happy to reach back out or provide a generic response via our post-event communication that will come out a few days after today's event. And with that said, let us begin. Just a couple of things. Many of you know who we are, but just to make sure that you do, we are Umoja. We are one of the 7 resource groups used to connect the American Red Cross employees and volunteers. Many of you know we put on several different events throughout the year, whether they be around professional development, whether they be around self-awareness, whether they be more in-depth discussions about the organization, the history of the organization and what the Red Cross is doing to serve communities. Ultimately, we really are a resource for people to express themselves and get some additional insight as people kind of go on this journey to contribute and support the organization's diversity and service mission. For those of you who don't know Umoja, it's a Swahili word for unity. Umoja can and we cannot be all that we are without you all. As you know, with the Red Cross, we are all about serving communities, and so the essence of Umoja is just that. And Umoja is also is the first principle of Kwanzaa, which is the Pan-African holiday that is celebrated every year, starting on December 26th to January 1st. And again, ultimately, what we are about is building unity and prosperity within the African American community. And when we say that community, we're not just talking about out there somewhere in the United States. We're talking about here at home at Mother Red Cross as well. And ultimately, all of those efforts are going towards fulfilling the Red Cross mission. So what we're going to be going over today is, again, talking about honoring the life of Dr. Charles Drew. We will also be talking about the Dr. Charles Drew University and going into some sickle cell awareness. We ask that everyone types in their questions during those presentations, because after both of our guest speakers conclude their talks, we will have about a 10-minute Q&A session. So we will be reading off some of your questions directly for our guest speakers so that they can answer and provide additional information and context. And lastly, we'll just have a few closing remarks. Before we get into the main program, we would like to be able to introduce to you our guest speakers. And so with that, I will turn it over to my colleague, Denise Edwards.
Thanks, Sierra. Good afternoon, everyone. My name is Tanise Edwards. I am the co-chair for the subcommittee of professional development, which we call Develop and Advance, on the Umoja Steering Committee. And I am so honored to welcome you to today's session and introduce you to our guest speakers today. The daughters of Dr. Charles Drew, Dr. Charlene Drew Jarvis, and Dr. Sylvia Drew Ivy. So first, I these they have some long, impressive resumes and careers. So I'll just highlight a few things in their bios, and then we can get started. I don't want to take a lot of time talking about them. I want them to talk to you today. So first we have Dr. Charlene Drew Jarvis, and she has, like I said, a long and distinguished career, and she's held positions as a neuroscience scientist, a legislator, and a university president. She received her bachelor's degree from Oberlin College, her master's degree from Howard University, and her PhD in neuropsychology from the University of Maryland, all while balancing the demands of being a wife and mother of two active young boys, which I can totally relate to. So, her research with co investigators appeared in scientific publications such as the Annals of Neurology, Neuroscience Abstracts, Brain Research, the Journal of Neurophysiology, and Brain Behavior and Evolution. And so she wanted to respond to the need to help rebuild the economy of Washington, D.C. after the riots that followed the death of Martin Luther King Jr. And so she ran for public office and was elected 6 times to the Council of the District of Columbia. And her reign was from 1979 to 2000. And her work as the chair of the Committee on Economic Development for more than 20 years was pioneering. The Washington Convention Center, the Verizon Center, business improvement districts, tax increment financing, and legislative initiatives designed to prevent redlining by commercial banks stand as important and collaborative contributions by Dr. Jarvis. Dr. Jarvis was appointed in 1996 as president of Southeastern University, and she founded by the WMC. I'm sorry, YMCA in 1879. And so, true to the mission of the WMCA, her goal was to give students both theoretical and practical applications of knowledge. And 13 years later, in 2009, she orchestrated a unique merger of the university with the USDA Graduate School in Washington, D.C. And so Dr. Charlene Drew Jarvis was named as one of the most powerful women in Washington by Washingtonian magazine in 1989, 1994, and 2007, and by the Washington Business Journal in 1985. And so she has a long legacy, not only as the daughter of Dr. Charles Drew, but also as a blood bank pioneer, as well as she has traveled to many Red Cross and bone marrow sites throughout the nation to speak on her father's accomplishments and to encourage participation from minority blood and marrow donors. And for her work with the Red Cross, she was given a service award from the Washington, D.C. chapter in 2014. So, also too, I want to introduce Dr. Sylvia Drew Ivy. She's currently a special assistant to the president of Charles Drew University of Medicine and Science, and her previous positions include service as the mental health deputy for Los Angeles County, executive liaison to Los Angeles County Commission for Children and Families, as well as the founder and project director of the South Los Angeles County Community Kitchen. She is a member of the advisory committee to the RAND Corporation and has served on the Kaiser Commission on Medicaid and the Uninsured since 1991. And she's a recipient of many awards, including the 1993 United Way Agency Excellence Award for the most innovative approach to service delivery, the J. Kaiser Family Foundation Nelson Mandela Award for Health and Human Rights, the Center for Women's Policy Wise Women Award, and the California Black Caucus Community Award. And so with that, I want to welcome both Dr. Ivy and Dr. Jarvis to our session today. And I will turn it over to you guys to talk a little bit about your father and his accomplishments in the space of blood bank.
Thank you, Denise. Dr. Jarvis, if you're speaking, you are on mute. Did you want to say a few words before we get into your section?
Good morning, or afternoon as the case may be. I am delighted to join Umoja Resource Group today to talk about the Red Cross, about Dr. Drew, to join my sister Sylvia. And I thank Lisa, one of the national co-chairs, and Ciara, one of the steering committee co-chairs, for the work which they have done in actually getting us live in this very important Red Cross challenge to make sure that there is diversity in our blood supply. I'm delighted to talk about Dr. Drew this morning and some of his life and times. Dr. Drew was born in 1904 in Washington, D.C. He was born of Richard T. Drew and Nora Drew. Nora Drew was a 1901 graduate of Howard University, and Richard T. Drew was the treasurer of the Carpet Layers Union in Washington, D.C., which at the time would have been very unusual. There were 5 members of the Drew family. The oldest member of that family, of course, was Charles Drew. Elsie Drew was the next in line, Joe and Nora and Eva. Elsie Drew died in the flu epidemic in 1918, and her death was a tremendous blow to Dr. Drew and was the reason, he said in his own handwriting, that he had decided to pursue medicine as a career. Dr. Drew was a graduate of Dunbar High School in Washington, D.C. Dunbar High School was well known for the quality of its graduates. And he attended Amherst College along with a number of the graduates from Dunbar High School, including Dr. Montague Cobb, Bill Hasty, who became the first African-American federal court judge, and Mercer Cook, who became an ambassador to Niger. So there was a great deal of talent in the high school and a great deal of talent that went on to Amherst College. From Amherst College, Dr. Drew went to McGill University Medical School in Canada. He, of course, had no opportunity to be in the medical schools of the United States because of the segregation at the time. McGill Medical School, well known, well regarded, and Dr. Drew was able to successfully complete his studies. But I would note that he would not have been able to complete those studies without the help of the Rosenwald Fund. Dr. Drew's, this was a time during the Depression, and there was very limited money available for Dr. Drew to be in medical school. In his junior year, he was not certain that he could complete medicine, but the Rosenwald Fund was able to make a scholarship available to him of $1,000, which enabled him to finish medical school. He went on from McGill University. He was there at McGill, a resident at Montreal General Hospital. He went on to Columbia University, where at Columbia Presbyterian Hospital, he was also a resident, but he was also studying for the Doctor of Science degree, which is essentially the PhD in surgery. When Dr. Drew was at McGill University, he studied with Dr. Beatty, who had a great interest in fluid balance and in blood preservation. When he got to McGill University, Dr. Scudder was a scientist who had also started research, particularly in blood preservation in his laboratory, and Dr. Drew joined that laboratory. The thesis that he did there was called Banked Blood. And it was in that thesis that Dr. Drew described methods for preserving and storing both whole red blood and plasma, the yellow substance, of course, that is drawn from plasma. The remarkable discoveries of both preservation and storage of blood and blood plasma were critically important as this country embarked on the Second World War. Dr. Drew would have completed his studies at Columbia in about 1941, but it was in 1941, or just before, perhaps in 1939, that Hitler had begun to invade the country and the world, and had invaded Poland. And then it became very clear on December 7th, 1941, when the United States entered the war, that there would be soldiers, thousands of them, going abroad to help save Hitler. And it was at that time that the work that Dr. Drew had done in blood preservation and blood storage became well known and critical in saving the lives of soldiers on the battlefield. The significant part of his discovery was that plasma could be dried and then could be reconstituted on the battlefield. That was very critical, of course, because whole red blood could not be refrigerated on the battlefield. And so plasma was really the life-giving substance during the war for saving thousands and thousands of lives. During the war, the Surgeons General of the Army and the Navy made a decision that blood donors could not be African American and make blood available to white soldiers. Dr. Drew opposed that policy vehemently. The policy was changed, but not very quickly. The Red Cross, of course, was the entity that the Surgeons General called upon to make that plasma available. And so it was as a part of the Red Cross history that it also was brought into the issue of blood segregation because of the Surgeons General of the United States. And I should note that in medicine, both in the South and in the North, medical people, physicians were taught that there were genetic differences in the bloods of African Americans and white Americans. And so that undergirded the decision of the Surgeons General to segregate blood. My father continued to object to that segregation, and he was joined in that by many, many people within the community. The NAACP, for example, Dr. E.B. Du Bois, for example, Bill Hasty, his classmate from Amherst College, who was a part of the War Department at the time, and who not only objected to the segregation of blood, but also to the segregation of the armed forces. So this was a very challenging time in our history. The AMA was implored by Dr. Drew to permit African American doctors to have staff privileges at all white hospitals. Those privileges were not approved by the state AMA organizations, and the AMA National often referred to those organizations to get that kind of privilege, which of course did not occur. It was not until 1970 that the AMA, in fact, apologized for its failure to allow staff privilege for African American physicians, which greatly impacted the number of African American physicians which we have today. It's very significant that the Umoja Group is working with the Red Cross, within the Red Cross, with its employees, outside of the Red Cross, with its volunteers, to not only to help diversify the blood supply, but to continue to push for the education of African American physicians, because it is they who understand some of the challenges in getting trust from our community because of some of the history. But the trust from our community is essential, and this is why the work of Umoja is so critical at the Red Cross. Dr. Drew was the director of the Blood for Britain project, and when he completed that service, he went back to Howard University. And at Howard University, he took on the very important task of training other surgeons. He held his surgeons to a very high standard. He said excellence of performance will overcome any artificial barriers created by man. And because he had a strong belief in the ability of his students to achieve in medicine, he pushed for excellence. Dr. Mordecai Johnson, the president of Howard University, came to visit Dr. Drew on the campus of Howard University and told him, according to our mother, that one of his students had placed second in the National Surgery Boards. One of his students had also placed first. So you can imagine the joy of having spent that time in the training of young physicians. Let me step back a minute because the early days between 1939 and 1941, really critical times for Dr. Drew. He found a beautiful woman whom he married in 1939. Her name, Lenore Robbins. Lenore Robbins was from Philadelphia. He met her at a party in Atlanta at Spelman College. He had only a brief opportunity to chat with her at a party before he went off to Atlanta University. And he came back that night, that very night, and pushed his way into the dormitory where she was a teaching assistant. And they were married within 4 months. My mother joined Dr. Drew in New York when he was working on his thesis, and when he finished it, and when he was being a resident and becoming an expert, not only at blood preservation, but also in fluid balance. My sister Bibi was born in 1941. My sister Bibi is named for Blood Bank because my father and mother had not named her at the time of her birth, and the nurses decided to call her Bibi, and that became her name. Bibi was born in 1941. Bibi was born in 1940. I was born in 1941. Rhea Sylvia, from whom you will hear, was born in 1944, and brother Charles Richard Drew was born in 1945. Charlie, unfortunately, passed recently from cancer, and we miss him a great deal. The policies changed with respect to blood, and I would note that in Washington, D.C., the National Blood Bank is named for Dr. Charles R. Drew. So the marriage between that name and Red Cross is a very important one It certainly is an important one to us, but it has become very important to the Red Cross over the years. And it is now relying on us and on you at Umoja to help make sure that African Americans and other people of color understand the importance that they have in saving lives. Dr. Drew would not like to be remembered for anything other than he sought to save lives. And through the Red Cross, you can continue to do that. Dr. Drew worked feverishly all of the time. He did have some time for opera and for gardening and for the saxophone. We lived on the campus at Howard University, so he had the chance to walk back and forth between the hospital and the university. He was devoted to the training of his residents and was traveling to Tuskegee to a conference with his residents. My mother had wished him to take a plane or to fly, and he decided he would not do that, even though he had been late in the evening at making a presentation at the university. And so in the South, as they drove, because it was the South, in 1950 at the time, he was driving. He became tired and he fell asleep at the wheel. Had he been able to stop, he and his residents, at a hotel which was open to people of African American descent, he might still be alive today. But again, it's not the circumstances of his death that we want to keep in mind. It is the circumstances of his life. That he gave his life to medicine and to his students and to the care of patients and to the training of physicians. There was a myth that grew as a result of that accident, that Dr. Drew had been denied admission to an all-white hospital, or that he was not given the transfusion that would have saved his life. My mother knows that not to be true. The residents who were with him at the time, all of whom lived, know that not to be true. The impact of his loss was such that the irony would have been just tremendous had that myth been true. Doctors Knodel, two brother surgeons at Alamance General Hospital, were the ones who treated Dr. Drew. He was severely injured because in the accident, the car essentially turned over on him, injured him severely. He could not have survived. And so the issue of this myth was not solved, actually, until a young woman at Duke University, Spency Love, did a PhD thesis in which she investigated that myth and discovered that there had been another African American, a man of the military, on the road there in Alamance County, who in fact had lost his life on the road some 4 months later. He was taken to a local hospital because of the severity of his injury. He was taken to Duke University Hospital, and in the South there were hospital beds set aside for African Americans and hospital beds set aside for whites. Mouthless Avery was denied admission and in transit to another hospital lost his life. That became the explanation for the myth that surrounded Dr. Drew's death. But the myth prevailed because in fact in the South there was not equal access to health care delivery. And so the myth lived because of those circumstances. But again, Dr. Drew's life was about life saving. His advocacy within the Red Cross was critically important. His advocacy outside of the Red Cross was critically important in changing policies about blood segregation. And so the many ways in which he has been honored since his death are, in fact, many. And we're very proud that schools are named for him, that young people understand his import, that we understand the circumstances of the world at the time that Dr. Drew was doing his blood research, and that it was at the same time that he did that research that Hitler was trying to take over the world, and that our soldiers had to be cared for and their lives saved. And so we want him to be remembered for those lives saved and for the African-American surgeons who were trained because he believed in them and because he believed in the excellence of their performance. And we believe in the excellence of performance of the American Red Cross and in the interest that the American Red Cross continues to have in diversifying the blood supply, and to the extraordinary work which is being done by Umoja in diversifying the blood supply, but in getting more, not only more people to commit to blood donations, but also to understand that there is a matter of trust which is built up within the organization and external to the organization of having Umoja at work during this. Trust is essential. And so the message has to be one not only of personal contribution, but of also spreading the word of the importance of blood donations. It is very interesting during this time of pandemic that the issue of blood plasma has been raised because of the use of plasma antibodies among those who have already contracted COVID-19. And so Dr. Drew's name has once again been in the news and circulating because of the work which he did in the preservation of blood plasma. And here again, there is an opportunity for that work, that understanding of the storage and preservation of plasma, to be useful in addressing a pandemic which threatens the entire world and reminds us very much of the flu epidemic when Elsie, Dr. Drew's sister, passed. And we are continuing to be proud of the work he has done in association with the American Red Cross and the importance now of donating blood, the importance now of being able to contribute to solutions to the pandemic and among people who have antibodies available, which in fact could help in preventing further disease. I am really
delighted. I just wanted to let you know that 2-minute warning, Mark.
Well, I think that's perfect timing because it gives me a chance to say once again to all of you who have chosen to listen today that we are very proud of you as employees of the Red Cross, that we are more than proud of those of you who are volunteers at the Red Cross, who are people of color and all who are not, because you're all one family, and that the importance which you have given in your work lives and in your private lives to the collection of blood is something for which all of us thank you, and particularly in the family of Dr. Charles R. Drew.
Thank you so much, Dr. Jarvis. Again, sincerely thankful that you took the time to tell us more about your father, Dr. Charles Drew, and all that he has done, again, not only for the African American community, but those in the medical field, the blended industry, those learn more about education, and ultimately also for the Red Cross. So again, thank you for your time and your willingness to share with us today.
Thank you.
All right, next, I will turn it over to Nice for a brief reintroduction to Dr. Ivy, and we will continue on to learn more about the Dr. Charles Drew University of Medical and Science, and also more about sickle cell awareness.
Thanks, Sierra. Thank you so much, Dr. Jarvis. I'm going to quickly turn it over to Dr. Ivy because I want to leave the floor for her and as much time. So again, I just want to reintroduce you to Dr. Sylvia Drew Ivy.
Dr. Ivy, you are on mute.
There, can you hear me?
Yes, we can. Thank you.
Okay, all right. Well, hello, everybody. Thank you, Charlene. That was a wonderful presentation. It's so great to have somebody who is a scholar in the family who can really give the history and give it accurately. And I'm so glad that she was able to share all of those important facts about his life and his importance. I am Special Assistant to the President of Charles R. Drew University of Medicine and Science. We always say Charles R. Drew University of Medicine and Science because we had an Australian president some years ago who thought it was a good idea to take the R out. And we didn't like that. So we always make a point of including the R. So Charles R. Drew University of Medicine and Science. And it is a wonderful health training university, which started in the Watts community in 1966, following the Watts revolt. So we are uniquely an institution that is indebted to the advocacy of the African American community, because the Watts community was like a big circle of neglect. We didn't have a hospital. We didn't have a training ground for physicians and nurses. We didn't have grocery stores. We didn't have so many things that other parts of Los Angeles enjoyed every day. So the governor, Edmund Brown, set up a commission, and that commission said there must be a hospital established in South LA. And that body worked with the local chapter of the National Medical Association to establish the hospital and a medical school so that there would be a place for training of physicians, starting with residents, so that the physicians could keep up their expertise and their training in a medical setting. So that's how the university was founded. And we continue today to have a community faculty that is our connection to what's going on in South LA at this time. We are training providers to serve in South LA and to serve in many, many other underserviced communities across the nation. Next slide, please. When we were trying to initiate the hospital and the medical school, these 5 women, Kathy Green, Lillian Mobley, Nola Carter, Mary Henry, and Johnny Tillman, 5 African-American women who were part of a group called Mothers in Action. And they were pistols. They were really pistol-packing leaders. And they insisted that these institutions be done and be done with excellence and be done with community connectivity. So whatever they said to us must be included, we included that. It was really quite a strong leadership. We were sort of afraid of them. I was on the early board of visitors in the beginning of the university when Mitchell Spellman, who had been one of my father's students, came as the first president. And Lillian Mobley would think nothing of calling up Dr. Spellman and just reading him the Riot Act about what must be done and when and who must be consulted. And that set the tone. So we've kept that connectivity. Next slide, please. We started out with a little mobile trailer. This is a picture of where we were. We didn't have much of anything. We didn't have much money. We didn't start out as a big medical school. We started out as a training facility for residents. That's a very odd way for a medical school to start. You usually start bottom up and you move to residency and you get one residency and then you get another one. But we started with the residency program and worked our way down to having a MD degree program, and then a nursing program, and then a PA program, and now we have an undergraduate program, and we have a program for the little kids that can start Saturday science to learn about medicine starting at 4 years old. So we have 1,000 students today. So it's really quite exciting that we've grown that much since that point in time. Always remembering the reason that we were founded because our community was in need and was neglected. Next slide. The vision of CDU is excellent health and wellness for all in a world without health disparities. And our mission includes cultivating diverse professional leaders dedicated to social justice and health equity for underserved populations through outstanding education, research, clinical service, and community engagement. You won't find another medical school, I think, that has social justice in its mission. We are active on many fronts, not just for African American community members, for Latinx communities, for Pacific Islander communities, for any population that is in need where social justice is an issue in the denial of necessary healthcare services and healthcare training. Next slide. So we're 54 years old. Howard University is 100 years old. So we're just still babes in the wood compared to some of the Eastern establishments. But we are known for our primary care training, the diversity of our students. We are the second most diverse student population in a 4-year private nonprofit university in the nation, second most diverse. We service underserved communities, and that's where we do our practice for the students. Every student at CDU, including our little ones, do research. You know, they start with very simple things for the children and all the way up. Everybody does research. Research is an integral part of our training. And we're also doing international programs. We have programs in Angola, Rwanda, and the Philippines. Next slide. I mentioned that we are the second most diverse. The University of Hawaii, Hawaii Pacific is the most diverse. And we also have, next slide, I don't know whether we got that slide. Yes, we are the #1 school in the nation for diversity of faculty. among four-year private nonprofit institutions. So we talk about diversity, but we walk the walk, and we've got a little bit of everything. All groups represented on our faculty, and that makes it really a wonderful environment for the students and an excellent preparation for them for service in underserved communities, because the underserved communities are of every stripe. When we started in South LA, it was 80% African American, and now it's 70% Latinx. So you have to be able to work across fields. You have to be able to work in diverse fields, and we're training students to do that. Next slide. We are at this point in our trajectory, rebuilding and rebranding the university from still growing from that little trailer to becoming a mid-sized university. We're not little anymore. Mid-sized, we have 1,000 students, and we have broad training in health professions, and we are pursuing excellence. And we are being recognized nationally now because of COVID-19, because we are in the community. And when COVID hit, we said, how can we be of service to our community? And we set up testing, and we were testing more than any other center in Los Angeles. We were testing 1,000 people a day. They lined up all around the entire block in cars, and we allowed people to walk up because many in our community didn't have cars. So we said, you can walk up same day, we'll register you, we'll test you. And we had a very high rate of positivity, and we still have a very high rate of positivity, particularly among Latinx members of the community. So we not only train, but we serve. And that's our whole mission, to train for excellence and to serve communities. So that is, in a word, what I want to share with you about the university. But I want to turn back for a moment, if I can personally, to talk about my dad. I was just 6 when he died, and I have very few memories as a result. But I remember one exchange that we had that I come back to. He loved gardening. Charlene said he loved gardening. And when he would come home from work, he would go back to our little backyard and our rental property on the campus, and he would plant flowers, and he would let me help him. And so he would dig the hole, and then he would give me the little plant, and it was my job to put the plant in the hole and to pull up the dirt and pack it down tight so the plant would be steady and grow properly. And so the first one I did, you know, I stuck it in the ground and pulled up the dirt quickly and was ready. I got next plant. He said, no, you have not done a good job with that one. We cannot move to the next one until we've done a good job with that one. So we would work on how to get the dirt just right and packed just firmly and meet his satisfaction, and then we could go on to the next one. So, you know, it's a good example for me of how to proceed with whatever I'm trying to get done, to just try to do a good job of the thing that's in front of me. Plant the seed that you're planting. Plant that one. So for the group that's assembled today, I say thank you for the seeds that you're planting. Continue to plant them and make sure that they grow before you move on to the next plant. And I'll stop with that so that you can have time for some questions from your audience. And I thank you very much for having us today and for learning from Charlene about his history and learning from me a little about CDU.
Wonderful. And don't go anywhere yet, Dr. Ivan. We still have a couple of slides regarding sickle cell awareness for you.
Okay, let me mention that.
Sure. Let me move to the next slide. And before I do, just as a reminder that for Dr. Ivy and also Dr. Jarvis, if you have any questions for them, please use the Q&A feature that should be somewhere on within your teams to submit a question. We will capture it and we will have them answer a few here on today's call after the end of this portion of the presentation. And for any of those that we need to provide in a response, then we can do so post-event. And Dr. Ivy, there was this one last quote from your father. I didn't know if you wanted to read to the group. I know on several Red Cross materials when we talk about Dr. Drew, this is one that we have across them. I know for me it resonates so much. But I wanted to know whether or not if you wanted to talk about it a bit or just leave it on screen for people to view.
Well, I think Charlene mentioned that this was a guidepost for him, and I think this is the way he managed the hurt of discrimination in the United States and against African Americans. He really believed that excellence in performance could and would transcend artificial barriers. There are a lot of people who don't really believe that, but I think he believed it, and I think he proved it, and his students proved it by their performance. So it remains a guidepost for us at the university, because it's not enough to be devoted to helping. It's not enough to be in training. You have to really be the best at whatever it is you're trying to do. And when you devote yourself to excellence, the fruit is there not only for you, but for those who will follow you. If you haven't planted the seed properly, it's not going to grow. That little flower's not going to thrive. Do a good job at the thing that you're doing and do it to the best of your ability, and it will bear fruit going forward. So it's a good expression, and it serves us well with our students. Sickle cell is a tremendous challenge to the health of African Americans, and increasingly now to Latinx populations. In the United States, there are 100,000 people with sickle cell disease. 90% are African American. 1,000 babies are born with it each year. A single patient with sickle cell receives up to 50 to 100 pints of blood a year. So getting blood banked is very, very important for African American patients with sickle cell. The hospital that was established after the Watts Revolt was Martin Luther King Jr. Hospital. And it closed in 2007, but has been reopened, and it has a wonderful new director, African American woman, and an outpatient clinic attached to it. In our outpatient clinic, the MLK outpatient clinic, there is a sickle cell disease center. Very, very important for this reason. Today, we have abundant services for children with sickle cell, but there's almost nothing out there for adults with sickle cell. This clinic is devoted to adults with sickle cell. It closed after everybody got sent home with COVID, but it has reopened. And it is one of the most important ways to reach out to the African American and to the Latino community to ask for their support in donating blood. I took my son to the emergency room once with a sprained ankle, and while I was there, a young adult came in who was having a sickle cell episode. I'll never forget his pain. He couldn't sit in the chair. He writhed on the floor. It's just the most painful thing to watch, this most painful thing to experience. And they provide multiple blood transfusion as the way to provide relief to patients who are having such an episode. So I think people don't know enough about sickle cell. They haven't had experience seeing it, feeling it. And it's a very important part of what the Red Cross is doing in collecting blood to make that available. Chronic transfusion procedures are regularly scheduled transfusions to prevent complication. The number of blood units needed depends on the size of the patient. So if it's an adult, they're going to need more, right, than a little person. And they might require 1 to 10 units just for one exchange. Over a lifetime, a patient can receive hundreds, if not thousands, of units of blood. Next slide.
Had to get myself off mute. So that is the information that we had for the sickle season awareness. And again, thank you for being able to provide information regarding Dr. Charles R. Drew University. And the history behind getting the university to where it is, and just showing how it's been such an instrumental part in the medical community, but as well as the local community as well. And also a little bit more information regarding sickle cell disease, because I think a lot of us know it really is it affects our communities significantly. And to your point, the more education that we can provide people, the more that hopefully that would encourage them to come into our doors to be able to donate blood and diversify the blood pool. So thank you for all of your information and your insight. So the next thing that we have for you all, we would like to take a few minutes and allow you all to ask questions to our guest speakers today. A lot of information has been shared. A lot of new insight has been given. And so for both you, Dr. Ivy, and Dr. Jarvis, we're going to read out a few questions for you. And we'll try to clarify in terms of who to answer. Feel free to either one of you be able to take over and provide any additional context, but really it's just an open forum for people to ask a few items and for you to respond. So with that, Jasmine, I believe you are there, correct?
Yes, I'm here.
Awesome. Do you mind reading off the first question?
All right. One question is, I know that Dr. Harold Merriman's initial work in long-term cell preservation involved freeze-dried blood before he turned to cryopreservation. Did Dr. Drew ever work with preservation of red cells?
You're muted.
Dr. Jarvis, you're muted.
The question is whether Dr. Drew ever worked with the preservation of blood cells?
Yes, that's correct.
Red blood cells?
Yes.
Well, yes. I mean, his work was the storage and preservation of whole red blood. And his work involved some very tedious sets of experiments, which were designed to determine how long blood could be preserved, what the course of deterioration of the blood was, the way to not only preserve it but to send it from place to place, from Red Cross to hospital, from local to national or international. And that really was the essence of his work. My husband is beside me, Dr. DeMaurice Moses, and he had written the word potassium for me to mention, which was a very important part of his work, because it appeared that there was, if you will, potassium release from the whole red blood, and they had to take into account the potassium level. And I'm gonna get a little bit more scientific explanation of the work which he did in doing his whole blood preservation work. And I'm going to defer to the next question and get Dr. Moses to help me with a very more specific explanation of the work on potassium. So will you come back to me on that?
Sure thing. All right. The next question that we have is for both of you. And we have someone that wants to know if you could both please share what you think your father's single greatest contribution to humanity. That was a very in-depth question.
Well, it's hard to get into his head to know that. But I would say that in terms of the ability to save lives, the work with preservation of whole red blood and plasma was the sort of sine qua non of the ability to save lives. But in terms of his own pride, I think it was in the training of African American physicians, because it wasn't just that he wanted them to be good. He wanted them to understand that they could be excellent in a society where the expectations were low, and the expectations were socialized as we know it now, in a way that made the whole country socialized to believe and to undervalue the contributions of African Americans. And he demonstrated, and he made his students, more importantly, understand that they could be not only good, but excellent.
I would offer a different thought about that question. I once talked to Andy Young about my father. He had been a student at Howard University at the time of his death, of my father's death, and he said it just hit us so hard, because we had at that time only one great national Black hero, and that was Joe Louis. And Joe Louis had died not long before them. And so Joe Louis died and a hero died. And then Charles Drew died. And he was a great hero to African American people because he had proved the caliber of our thinking and of our contributions and of our value, not just to our own community, but to the community of the nation, of the world, in what he did in his blood plasma work. So he became a symbol of our own excellence and the failure of the larger society to acknowledge and respect the excellence that we are due as a people. I refer you to a poem by Maya Angelou, When Great Trees Fall. If you have a chance to look it up, it was a great sorrow. And at his memorial service, the lines were just so long of the cars. I remember the cars, and my little brother saw his car, which was being driven by someone else, and said, "There's Daddy, there's Daddy." And it fell to me to tell him that that was not him, that there was someone else driving the car. But he just wanted him to be alive, and the people wanted him to be alive because we needed him. We needed his symbol. So I'm glad that we have an institution at Charles Drew, and there are many other schools named for my father across the country. But this is the only medical school that keeps his spirit alive and keeps his confidence in our capacities alive. And so I think his greatest contribution was that symbolic evidence, of the greatness of our people as well as the greatness of all other people. But we stand with them in capacity and in service.
Wonderful. Thank you so much for sharing it. And speaking of the university, the next question that we have is, what strategies does the university implement to maintain diverse faculty and student populations?
We work very hard at it. You know, we send out people, and now we have to do it virtually. But we let the community at large know what our dedication is to a diversified student body, to serve a diversified population, never forgetting our founding at the impetus of the African American community in South LA. But we reach out far and wide, and we have a wonderful provost who's Nigerian, who is extremely skilled in how you recruit and train members of the faculty to carry out that diversity with excellence. So it's always both. It's devotion to underserved needs and performance at an excellent level. And people want both of those things. And everybody who comes to work at Drew says, I came for the mission. Every student who comes says, I came for the mission. So mission is very, very important. And it draws the people who train, and it draws the people who learn.
Thank you, thank you. Okay. Another question that we have for both of you, and Dr. Jarvis, I'll let you know that you are on mute again, is how can we, what is the one thing that your father taught you that has pushed you through life? And I'm sure there's probably several different items that you've learned over the years, but if you could share one or two of those items, that would be wonderful.
I learned the same lesson that his students were taught, which is excellence of performance will transcend artificial barriers created by man. And my father was, he had a high demand for excellence, a high demand for achievement. And I believe that has been a primary factor in my life. I seem to have what my father had, which is drive. And I read somewhere that he described the horse within him that never slept. I must say that I have felt all my life also the horse within me that never slept. And it had to do with my father's expectation of achievement. I can remember the instances when it was necessary for my father to sit with me to learn something in school. Remember that I lost my dad at 8, Sylvia at 6. And so I had some opportunity to to have him sit with me to do some schoolwork. I always tried very hard to do my schoolwork because I actually didn't want to have him sitting beside me because he was the kind of stickler for outcomes that he was with the plant that Sylvia was planting. And so one of those subjects was geography. And I remember some long sessions at the table on geography and the expectation that I should master this. So I think mastery of your subject, mastery of your goals was what I learned from my dad. He was a person of high demand, but a great deal of gentleness.
Well, I would answer that I remember him being very, very devoted to family. And he enjoyed all of the Christmas doings. We would go down to the train station and pick off a tree coming in on a freight car. Fresh, smelled so wonderful, and take it home, and he'd chop the bottom off and help us decorate. And I remember when BB would take the icicles and just throw them up on the tree, and he would say, take that bunch of icicles down. They must be put up one icicle at a time if it's to shimmer and look like snow and ice on the tree. So attention to detail, even in trimming the Christmas tree, planting the flowers. He would hide Easter eggs in the hollow of a tree in the front of our house. He was involved. He would take us to the Rock Creek Park in the car, and when we crossed a very shallow creek, he would pretend that the car had stalled, and we would all shriek and just be so upset that we were all going to drown, which we knew we were not, but we all pretended that we were going to drown. And then suddenly the car would work again and we'd go to the other side of the stream. But he enjoyed family. He enjoyed 4 children, and so I remember that joy. And I remember that my mother talked about him really being a person of simple tastes. He liked to watch, listen on the radio, I think, because I don't think they had a television when he was alive. Listen on the radio to the Lone Ranger and various cowboy things on the radio. So he just worked and worked and worked and you know, loved his students. You know, he loved his students almost as much as he loved his family. If anything was going wrong with them, boy, did he go to bat for them. When people who had passed their boards couldn't get a position, he went to bat for them. He took on the AMA for their discriminatory policy. So he just was a generous person. He was a generous person, a loving person. He wasn't isolated in his excellence. He was really bound to people, loved people, and connected to people. That's what I take away.
Thank you for that. And before I read the last question, Dr. Jarvis, you said you wanted me to come back to you from the initial question.
Yes, apparently in drawing the plasma from whole red blood, he found that there was considerable potassium in the plasma, and potassium is an electrolyte that has to exist at a certain level in order to be properly used by the body, and if it exceeds that, it can in fact be dangerous and lead to disease. So part of his work was to try to figure out how to make sure that the level of of potassium in the plasma was at an acceptable level.
Understood. Thank you. Thank you. Okay. Well, we have time for one more question before we move on, and so I would like to close with this one for you both. The question is, how can we best honor Dr. Drew's legacy?
I think you can best honor Dr. Drew's legacy by connecting his mission of saving lives to the mission of the Red Cross and to every person who is willing to donate blood. In other words, the mission of Dr. Drew to save lives is embedded in the Red Cross's challenge to make sure that there is sufficient blood in the blood supply to save lives, and that they could honor his memory by focusing on his passion and to try to understand that the trust that is necessary to give blood is a direct connect to Dr. Drew's passion to save lives.
I think another way to honor his memory would be to seek partnership with entities that are serving his vision of excellence in healthcare, like Charles R. Drew University, and there are other potential partners, but work through community. Don't stay isolated within the corporation, but connect. And I know that you already do that in many, many of your wonderful services, but to do that specifically in minority serving institutions in his name would be much appreciated by those minority institutions, and would help to telegraph that the Red Cross is in a different place today than it was way back when the Navy was calling the shots and saying, don't collect black blood. It's a different day. So let's do things differently. Let's partner differently. And let's move forward together.
Absolutely. And before we close out this part of the presentation, one thing I wanted to make aware to you both, as well as everybody else on the call, and this is coming confirmed by the Office of Diversity and Inclusion, is that Gail McGovern's office, or the president of the Red Cross, her office has approved a name change to our annual Diversity and Inclusion National Award. And going forward, that award will be named the Dr. Charles R. Drew Memorial Diversity and Inclusion Award. So Dr. Drew means so much to the Red Cross and to communities, and so just to honor him and also those who embody what, about saving lives in community and such. I think that is a very well-named award. So
very important. It connects Dr. Drew's name to the importance of giving, and I think, and I hope that will help with the trust within our community to understand the importance of giving.
Absolutely, absolutely, and sincerely wanted to thank you both again for taking the time to talk with this um, group today. Sure, life is busy and there's a lot happening, but the fact you were willing to take a moment and share all that you have with the group, we can't thank you enough. And hoping that we could also continue this in the future and invite you all back too, so we can continue the discussion and share what we're doing and what you're doing and how we all can do more together.
Thank you very much on my behalf, and I'm sure on Sylvia's. We rush to accept.
I will pencil you in already.
Thank you, everybody, for being online.
Thank you, everybody.
Thank you. Okay, so we just have a few more minutes. So wanted to close out with just a couple of updates. And so as we get there, wanted to take a moment and thank everyone who submitted interest for the Legacy Mentoring Program. You should have received several emails, communications over the last few weeks during the application period. And for those who are a part of the program, further communication and confirmation would have been sent to you. And extremely looking forward to the first meetings in October. Also, as always, for people who want to know more about potential career opportunities at the Red Cross, we always invite you to continuously check the Red Cross job page. All of the different positions are listed there, as well as their descriptions and their any details in terms of how to apply or the qualifications for that particular opportunity. Also, you have received several communications from us this month, one of them being our September newsletter, in conjunction with some additional information regarding sickle cell awareness. September is Sickle Cell Awareness Month, and as we mentioned before, we really want to make sure that we are educating people regarding the disease and treatment and the importance of being able to donate blood and encouraging others to donate blood. And hopefully you've got a little bit more context today in terms of why that's so important for us as Red Crossers, but us who also identify as being a part of the African American community and those who are just allies in general about what it means as a whole to diversify the blood pool. One of the things that we will make available in our post-event communication is a one-sheeter that has a little bit more information regarding sickle cell disease, and again, some of the importance of why to donate. So feel free to share that within your internal network as well as your external network as well. We will also be sending you, as part of the post-event communication, a one-pager about Dr. Charles Drew, and it outlines some of his accomplishments and his contributions throughout his career. So hopefully you've learned a little bit more today directly from Dr. Jarvis and Dr. Ivy, but we also wanted to share with you that flyer as well for you to read up a little bit more and also share the knowledge and information with your networks. Lastly, as I kind of close out these calls, I always like to say, Umoja is about community, and we can't be all that we are without you all. You all are our community, and so we are always looking for new members, and we're also looking for people to join subcommittees to help specifically on some of our goals and tactics that we have going on. There's a lot that is happening within the organization, within the communities that we serve, within our own communities, in the country itself. And so we have a lot of different efforts to continue pushing the Red Cross mission forward in various capacities, but we can't do anything without help and without people who are passionate behind helping those in need and helping bringing people together and so on and so forth. So if anyone is interested in helping regarding a specific goal or tactic, please reach out to me directly. I'm Sierra Namude, And I'm happy to put together kind of a group call so that way others on the executive group and who lead some of the efforts can communicate a little bit more in terms of what we're looking for, and also help you identify your passions and where it might be best aligned for a subcommittee. If you or anyone else wants to be a Umoja member, you can fill out the general member survey. And again, when we send out the post-event communication, this will be linkable. It will take about 2 minutes for you to fill out your information and identify you want to be part of the Umoja African American Resource Group. And for those of you who want to be a little social with us, we have a private Facebook page. Once you're a Umoja member, you can be a part of the group. Please note, and I can't stress enough, that once you ask for access to join the group, there are a few verification questions that you must answer, all of them, because again, this is for our community, the Red Cross Umoja community. It's not just for anyone to particularly join. So we utilize those questions to verify that you are associated with the Red Cross, either as an employee or as a volunteer. And also just like to understand a little bit in terms of where you might be located and what part of the Red Cross that you are associated with, whether it be a particular department or area and so on and so forth. So again, we cannot be all that we are without you. So please, if you're interested in just being a member or want to be a part of a subcommittee, please contact me directly, or you can email the Umoja inbox and someone will get with you shortly and be able to continue the conversation there. One thing I would, before we completely close out, there's a few people that I would specifically like to thank for helping to put today's event together. One is Linda Mathis for facilitating the discussion and helping to bring people together so this could happen. So sincere thank you to Linda for her efforts to make this possible. Also would like to acknowledge and thank several Umoja and Otis members who are part of making today run smoothly. You have Denise, you have Lisa, you have Jasmine and Maya, and you have Gina, who's part of the Office of Diversity and Inclusion. And I'm sure I'm probably forgetting a few others, so my apologies, but something like this could not happen with multiple people involved who are just dedicated to getting good information, good conversation, good dialogue out there. And so wanted to say thank you to those individuals as well. And with that said, again, a sincere thank you to everyone on the call for taking the time to be a part of this event today. It really was an honor to have Dr. Jarvis and Dr. Ivy talk about their father and talk about sickle cell awareness. Two tremendous discussions that went on, and hopefully you all felt encouraged to learn more, to do more. We welcome your feedback for future events. And with that, I wish everyone a wonderful day. Be happy, be healthy, be safe, and we will talk to you all soon. Thank you so much and have a great day.